Welcome to the State of Mind virtual speaker series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Welcome, everyone. Welcome to the State of Mind Speaker Series live webinar. This speaker series is a partnership between 1 in 5 and MindPeace. And a special thanks to the Hamilton County Mental Health and Recovery Services Board and the COPE grant for their support of this whole series. We'd also like to welcome everyone who is here live on Facebook. And it is my honor and pleasure to introduce Julie Knueven. Julie is a licensed independent social worker supervisor who will be talking to us today about recognizing anxiety and depression in youth. Julie is a director of child and adolescent programs for Solutions Community Counseling and Recovery Center. She has over 30 years of experience working with children and families. She has an undergraduate degree in child development and family studies with a child health emphasis from Purdue University. Her graduate degree is in social work from the University of Cincinnati. And she has 20 years of experience in leading and supervising teams in social work, treating families and children. Julie's also trained in trauma treatment, as well as many behavioral approaches to treatment, and she provides training on topics specific to family and children. So we are just so thrilled to have you today, Julie, and welcome.
Thank you. Thank you. I'm excited to be here.
Okay, I'm going to share the screen and share your slides here.
Great.
Just a second to get those up. The technology part of all these webinars. Give me one moment. Okay. Okay. Are you seeing them? Yes, I think they are there. Wonderful. Yes. Okay.
I am seeing them. So today we are going to talk about anxiety and depression in youth. And specifically, we want to talk about these times during a pandemic and what it means for kids in dealing with maybe some anxiety and depression. So we want to talk about that. And I want this to be interactive. So if you have a question, please make sure you're submitting those questions so we can talk about specific issues that you might be seeing or concerns you have. Okay?
Yes, Julie, thank you. I did forget to mention to please feel free to put questions in the chat, or if you're with us on Facebook, please feel free to put them in the comment section, and we will, I will let Julie know that those questions are there. Thanks, Julie.
Great. Okay, we can go ahead and advance to the next slide. Right, so our goals for today are to define anxiety and depression. Oftentimes we throw those words around, and so I want to really get clear about what we're meaning and talk about symptoms. What does it look like? And also give you some things about what you can do if you're concerned, what you can do right away to help your child. Okay, we can advance. So anxiety is excessive worry or apprehension, lasting more than 6 months and more days than not. 6 months is a long time for kids. And so in a school year, that's most of the school year, right? So excessive worry or apprehension. So what is excessive? We want to define that a little bit more. So go ahead and advance. Looks like we lost the slides, Christine.
Yep, it wasn't showing up on Facebook, so I wanted to make sure that I think we're back now.
Okay, great. Okay, all right. So excessive anxiety or worry. So that seems more than what you would think. So for kids, for little kids, Excessive anxiety or worry is something where they just are worried all the time, and it's more than maybe what you would see in other children. So excessive anxiety or worry. An example of that may be that they anticipate something happening and can't quite get rid of that thought, that they really are worried constantly about that and cannot maybe talked out of it or calmed down by reasoning. And it occurs quite a bit. It's maybe not just for one thing, but for lots of things. So they're worried that they will get sick at school. They're worried that they'll be made fun of because they don't have the right clothes. They're worried that their teacher is going to pick on them. They're worried. They just worry about many, many, many things and not just one thing. And they can't control that worry. It takes over everything. So during your day, if you're seeing your interactions with your children and it just seems like everything is a worry, everything makes them anxious, that could mean that you might need to talk to somebody, that it is excessive. And restless or on edge, so they bounce their leg all the time, or they have a physical symptom, or they self-soothe all the time. So it might be that they have excessive energy. It might be that their breathing is escalated, or the look on their face is always worried. It also can be that they're easily fatigued, or they complain that they're not sleeping. Anxiety is definitely worsened by not sleeping. So if kids are worried and they're not getting enough sleep, that can cause anxiety to be even worse. And sometimes kids complain that they can't concentrate. They're so worried about something that they can't concentrate on what they're supposed to do. They're so worried about something going on that they just can't concentrate. And that can even be schoolwork. If you're doing virtual learning and the child is so concerned about something that's coming up and they can't concentrate on what is being presented, that could be a sign of anxiety. Oftentimes, anxiety shows up as irritability. They can just be irritable and not their sweet kid that you know and love, that they just are irritable and moody. Muscle aches and pains. So sometimes kids complain a lot about muscle aches and pains, whether it's a headache, a backache, a stomach ache, or just generally they don't feel good. Sometimes those stress hormones in their body just make their body ache and hurt. The anxiety or worry can cause difficulties in friendships or tension at home, classroom functioning, or ability to do the work online. So if you see that friendships are really strained because your child is worried about something, especially with teenagers, we see a lot of complaints about friendships that, it's not fair, or, some kids are hanging out with other kids and they're not included, or they are worried about their friendships constantly. Tension at home. So the worry becomes so excessive that it's overwhelming. They're worried about everything and you don't know how to make that better. And classroom functioning. So we see a lot of kids who go to school who have a lot of anxiety. And so ADHD is probably the #1 diagnosis we have for younger kids, but anxiety is the close second. And so even if they do great at home, they may have a lot of anxiety around school. And so sometimes we see that play out in the classroom. Maybe they feel like they can't keep up, or they put stress on themselves to be perfect in school. And so that causes them to be really concerned and really worried. and their ability to keep up online. So I know when I can't get on a meeting, it causes me anxiousness, right? I should be on this meeting. And so getting online, making sure that they're following. Sometimes it's hard for kids to do online learning. It's maybe not the best way for them to learn. And so they're struggling with that style of teaching. And maybe they're just not as quick as others to be active online. So there's a lot of worry sometimes that can happen with that. And motivation to keep doing the work, right? When you're not in front of that teacher and they say, where are your assignments? It's much easier to avoid that when you're doing online. And it's much easier to sleep through a class. It's much easier at times just to avoid it rather than deal with the anxiety. Okay, we can advance the slide. So some amount of anxiety is expected, especially during a pandemic. It is expected that they're going to have some kind of anxiety, especially around a quiz or a test, starting a new school year, right? We all have those first day jitters or, the schedule. Will I be able to follow it? Even the new way of learning. Will I be able to meet all my teachers' expectations? What if we start going to school and we can't finish there? Am I going to miss all the things I enjoy about school? That is a normal anxiety. Those are things that would cause anyone to have a little bit of anxiety. What we want you to pay attention to is there a pattern? Is there a pattern in when they're feeling anxious? Are they getting a stomach ache every single morning before they go to school? Are they getting anxious or emotional when they're talking to you about a particular class or expectations in school? Are they talking about maybe expectations at home and getting emotional? Is it daily or is it throughout the day, multiple times through the day? And does it seem to be lasting more than just starting jitters or starting, even if they've experienced school the first week, the first couple days, but it still is really anxiety provoking. Sometimes we can attribute anxiety to stress going on in your life, like an illness in the family, a divorce or a separation, a move, a new child, or even a sibling going to college. All of those things are normal, everyday occurrences maybe, but has something changed in the child's life that is making them anxious. So besides all the things about school that they might already be anxious about, is something else happening in home. And we can't always control changes in home, but pay attention to when they're becoming anxious and to try to see if they are reacting to some changes in the home or their environment. Okay, go ahead and advance a slide. So what can you do? Find a pattern. So really try to look for that pattern. Is it around the same time of the day? Is it in relation to schoolwork? And then support them. So oftentimes we go right into solve mode, right? When our kids are trying to tell us something, we go automatically right into solving their problems. When what we want you to do is get them talking to support their feelings, validate their feelings. I can totally see why you feel that way. I'm sure it is hard. So giving them that feedback and validating that it's fine to feel that way. Teach them to breathe. So breathing is the number-one way we can help kids quickly de-escalate if they're feeling anxious. And a deep breath in. So sometimes with my little kids, I teach them to try to blow out a candle. So you want to breathe in through your nose and out through your mouth. And the way kids learn that is, remember, you're trying to blow out a candle. So breathing deeply de-escalates. And if you can teach a child to breathe, it's also a very maybe not as noticeable way to deal with anxiety, so they can breathe anywhere, right? They can deep breathe anywhere and maybe not be as noticed. Are they able to calm down with some support? So are they able to come to you? Are they able to come to someone else who they trust to talk and kind of de-escalate? We want kids talking. We know that keeping all of that stress inside does harmful things to their body. When you keep those stress hormones in your body and don't work through them, that can cause some undue stress on your entire body. So we want them to get it out. We want them to talk, and we want them to get help calming down so that they can learn how to calm themselves down. And consider a referral if nothing else seems to help. Go through your school counselor. Most schools, Mind Peace helps us with partnerships in the area schools. And so go through your counselor or go to the Mind Peace website to look at the partnerships in each school. Or reach out to area agencies. Our local mental health board also has listings for providers also. So seek a referral for treatment. Your child does not have to have therapy in school. Many agencies see kids by telehealth, mostly during these times, but they have times at the offices too. So if you're nervous about pulling kids from school or the school knowing about mental health issues, there are other options. So look into those options and see what works for your family. Okay. Worry stones. So this is one of my favorite. Sometimes there are little stones that have words pressed into them. And so a worry stone, sometimes tactily feeling something can help, especially if you present a worry stone to a child and say, when you're really worried, think about me. Think about what we've talked about and feel that stone so you can actually remember what we said. Sometimes that texture, that just doing things like that can get their mind off the worry and onto what you've talked about. Bracelets with texture too. There are plenty of bracelets out there that can be fashionable too, but that kids can feel to help them remember. So even if you say, oftentimes for my teenagers, I say, have a mantra like, I can do this. And so if you have a bracelet, you can maybe touch a bead in the bracelet. I can do this. I can do this. I can do this. And then that kind of interrupts their anxiety. Cold water. So cold water kind of tricks our body into de-escalating. So having them have a water bottle where they can just take some sips every now and then to prevent getting overly excited or overly anxious. So deep breathing. So I mentioned that there's the STAR method where you can actually use your hand to breathe, where you take an inhale, pause, and exhale. Inhale, pause, and exhale. So kids can do that. They can always, sometimes they need help in regards to how long to breathe in and how long to breathe out. And so that helps with that. Coloring, doodling, that kind of stuff can also really help kids. So if they're online, have a color book by their workbooks or their work and just help them color. Oftentimes kids can do two things at once. And so it often will help them with really intricate designs to pay attention even better while they're coloring or doodling. Take breaks. Have kids take breaks. You know, it's probably more important for high school students even to take breaks than maybe even the little kids. Sitting at a computer staring at that screen for 4 hours, 6 hours straight is not the healthiest. So take a break. Remember to get up and stretch, where we get those hormones maybe that are in our muscles, we work them out. Keep a schedule. So I know some families, it's harder when you're doing virtual, right? To get kids motivated to get up out of bed and working. But it is important to keep a schedule. Prepare and talk through. So when you kind of get an idea of what kids might be anxious about, then prepare them for that challenge. Maybe prepare them for something that may be coming up that you think they will be anxious about. And talk through what they can do to help deal with their anxiety in regards to that situation. Okay. So depression and anxiety, you'll see on these slides that depression and anxiety can look very similar. And so as someone who deals with kids every day and their symptoms, I am not asking you to make that decision about what they have, whether it's anxiety or depression. If you go into treatment, your provider will help you decide those things. Okay. And one thing I want to really say in regards to going into therapy, not all kids are on meds either. So don't think that just because you get into therapy, they will automatically go on medications. That is not always the case. Especially for young children, we really look at that, and we don't want to medicate kids where we don't have to. So consider that and be vocal and advocate for your child if that's not something you're interested in. Okay, so for depression, angry outbursts. So sometimes depression, especially in younger kids who maybe can't vocalize their feelings, looks like anger and excess energy all the time. So most of the day they have these angry outbursts. A depressed mood that lasts most of the day, every day. If your preteen or teenager is really having a hard time getting out of bed or coming out of their room, they may be depressed. And so consider that this is something you really need to look at. Less interest in things they like. So they may suddenly say, you know what, I don't want to play baseball anymore. I'm tired of football. I'm tired of cheerleading. I don't want to dance anymore. If those things are happening, it may be a depression. So consider that they may be depressed if they're suddenly stopping those activities they enjoy. A significant weight loss or gain. So either way, if you see a significant change in their weight, that may be a sign that they have some depression. They can't sleep or they sleep all the time. Again, that can be a sign of depression. Fatigue, no energy. They feel worthless. So what do we mean by that? Feel worthless. They may make some negative statements about themselves. They may feel like they're just not worthy of someone's love or attention. They make degrading remarks about themselves all the time. That is what we mean by worthless. They can't concentrate or think. And so they can't even, if they turn on the computer, they can't even concentrate on what is going on. Maybe they have the computer on, but they're on their cell phone or they're doing something else, and they can't concentrate or think clearly. Or they forget. Like, you know, if you have talked about something and you say something to them and they're like, I don't remember that. That could be a sign if that happens over and over and over and over again. Now we know kids often say, oh, I forgot to take out the trash, or I forgot to do my chores. Now that probably is not depression, but if you remember having a really long discussion about something and they forget about that, then that could be a sign. And they think about death. So if they make statements about death, that is something that you should really talk to your child about and really, really consider. Okay, we can advance. So depression can look like anger. So it can be that they're just mad about everything all the time. And it can cycle throughout the day. So they're mad in the morning, then they quickly change to being their happy selves, and then they're mad again within another half hour. It can quickly cycle, and so that can be depression also, and or have extreme mood swings where they're throwing a fit, especially for little ones, kicking, hitting, destroying things, and then they're happy uh, a few minutes later. So extreme mood swings can be a sign of depression, and they're just not themselves. So if you know your kid the best, you as their parent, guardian, caregiver know them the best. And so if you see that they are just not themselves, then you need to be talking to them to kind of figure out what's going on. It may be depression. Okay, advance a slide, please. So cutting. So in regards to depression, this is something important that I wanted to talk about a little bit today too. So cutting. So teenagers especially, or preteens, may have some cutting behaviors. Now that is a little bit different than suicidal ideation. And it doesn't necessarily mean they're trying to kill themselves, but it is a serious behavior. And so if you see that your child is cutting, it is important to seek help. And because cutting does so many things to their body and to their psyche, you need some help to help a child get through that behavior. When kids cut, there's a huge rush of hormones. And so after that initial cut, and so one thing that we worry about is that kids continue to do that behavior, and it gets worse. So we do get worried about that. And one reason I wanted to talk to you about this too is there's lots of videos, lots of media, a lot of social media out there about cutting. And so I would encourage all parents to really monitor the kids on social media. I know it's impossible to be seeing everything that they see or hear on social media, but monitor and talk about it. So talk about what you're concerned about, what they see on social media. If you're worried about the exposure out there, if you're worried about the bullying online, if you're worried about their self-image compared to others, make sure you're talking about that and talking about your values in regards to social media. Okay. So suicidal ideation is thinking about it. And so it's hard sometimes as a parent to know the difference about whether they're, just thinking about it because they're mad, or whether they're truly thinking about killing themselves. And so you need to ask that question. If you are worried that your child may be considering this, you need to ask them. And so the scientific evidence out there is that asking a child is the most important thing you can do to help prevent it. So we know that that if they're not thinking about it, asking the question is not going to put it in their head. We know that asking the question is very important. So saying to a kid, are you thinking about killing yourself? Make sure that you're asking the question if you're worried about it. And then if you're asking that question, you need to prepare to act quickly. So you need to prepare. If a child says, yes, I have had some thoughts about that. There are hotlines out there. I know Mindpeace and 1 in 5 has all the resources out there on their website to get the local resources to help you immediately. But you need to get kids into treatment pretty quickly if they're thinking about hurting themselves, if they're thinking about killing themselves. That is definitely something that you need help with. Okay, advance a slide, please. So monitor and talk about social media and monitor their blue screen time. One of the things that we have seen in mental health is that kids are getting less and less sleep. And it does have an effect on their mental health and their ability to function all day, every day. It's compromised when they are totally in front of a blue screen and at night. So helping your child get a healthy bedtime routine where they don't have their phone or their computer on all night with the blue screen. There's some scientific evidence that we know it changes how our brain functions. And so we know that we need to monitor and help our kids have a healthy lifestyle. And that includes our sleep and our sleep patterns and making sure they're getting to bed. But monitor and talk about the social media. Talk about what happens when they post something on TikTok or when they post something on Snapchat. What happens to that and how important it is in regards to your values, your family values, and what you believe. So that's a very important lesson for you to teach your kids. So, and even mirroring what you're putting on social media, right? Teach by example. And make sure you're doing fun things together. So when I wanted to get to talk to my kids alone, and it is important to have alone time with kids if you have multiple kids in your family. And so for each one of my kids, it was different. And so making sure that you have that alone time every once in a while, just to check in with my son, my oldest, right after school. He would come in and talk to me to kind of debrief about the day. My daughter, who was taking her to Starbucks and getting her a special drink and just chatting. And with my youngest, it was spending individual time with him. So, so whether that was going to get an ice cream or just sitting in the car and talking for a couple minutes. But those times are important. Have fun together individually with kids, have fun together in families. It's especially important to kids to understand their value in your family. That's where they start to understand their value is in your family and in your relationship with them. If you see depression that lasts, seek help. Seek help. I can't say that enough. Parenting is the hardest job out there. And we all need help every once in a while. It does take a village, like the African proverb, right? It does take a village to raise kids. We always can't do it all by ourselves. So there is some evidence that medications can change chemicals in our brain, and especially in depression, when there is a serious depression, sometimes it is a chemical imbalance. And we can figure out that by doing some testing and doing some assessments and screens. And so not every kid, again, needs to go on meds, but sometimes it is helpful in deep depressions so that we can interrupt some of those thoughts and help them learn to heal and learn to become healthy again. Okay, you can advance the slide. So, questions.
Julie, yes, we have had a few questions. One parent wrote, what do I look for if I'm concerned that my child might be cutting?
What do you look for? So what they're wearing. If it's really hot out and they're wearing long pants or long sleeves, sometimes they do that to hide. Or if you see scrapes or nicks on their skin and it's not well explained, or they say, oh, I ran into the dresser, but it's happening a lot, you need to be concerned about that. And or you find scissors or knives missing, or things that normally would not be in their room are in their room. That can be a sign maybe that they're cutting, or bloody band-aids or bloody washcloths, or that can be a sign maybe that they're hiding some cutting.
Another person wanted to know, which is more common in children, anxiety or depression?
Oh, that's a tough one. I'm not sure. Sometimes I diagnose kids with both. And so more common, maybe anxiety is more common. Um, if we're talking about all ages of children. For older teens, depression can happen later too. 14 to 18 is a huge age gap, but probably where we see more significant depressions. So anxiety overall is probably more frequent, but certain age groups can have more depression.
Thank you. Sorry, I've got people, my son is out mowing our grass right now. So if you hear that in the background, welcome to virtual meeting.
Yeah.
So another person wanted to know if you could talk a little bit about eating disorders.
Okay, so eating disorders often come with an anxiety or depression. So an eating disorder, there are many kinds, and there's a huge spectrum of eating disorder, but often it can be tied as a symptom or behavior of an anxiety or a depression. So eating disorders, eating differently or choosing not to eat or really limiting your food intake can be a symptom also of anxiety or depression. And eating disorders is something that I think we should not hesitate to get some help with. It definitely can affect your health. So if kids are making themselves sick, if they're throwing up, we know the strain on the body is really really bad. And so we want to help them also understand why they might be having those behaviors. So what is the trigger for that? What happened? And trying to help them understand their body and the nutrients they need, and maintaining a healthy lifestyle for long term. So eating disorders is something that I would say absolutely, if you're seeing an eating disorder, start with your doctor and talk to them about what you're seeing, and then get a referral to someone who can help you understand that, and help your kids learn and stay healthy.
Another question we had, someone said that they're afraid, they've heard before that you can put the idea of suicide into a child's head if you bring that up, that previously wasn't there. Can you, she wanted to know if you could talk about that, please.
Sure. We have some science behind this, signs of suicide, and some other evidence-based programs talk about this specifically. And if a kid is thinking about suicide, you're not going to put that in their head. It's they either are or they aren't. And so my experience especially has been, if I ask it, they will tell me. If they're not thinking of hurting themselves, then they're like, no, are you crazy? But you can't put that idea in their head. If they're not thinking about it, they'll have a strong reaction. And if they are, most time kids tell me they're relieved that someone asked them. They're relieved and feel this huge weight off their shoulder. Kids want help and seek help and don't always know how to say it. Sometimes kids don't tell us that they're suicidal because they're afraid of our reaction. And so there's quite a bit of science out there in regards to this topic, and it's that is false. If you if you talk about it, you're not putting it in their head. Um, we know from countless studies that asking the question gets them talking, and asking the question helps. So that's what science is telling us, is that we do need to be open and in our communication and ask the questions.
Great. Um, Julie, I just would like to say thank you so much for this presentation today. It was extremely educational, and I think will be helping a lot of families if they're concerned about depression and anxiety in their child,
Sure,
especially during this crazy time. So again, thank you, Julie, from
sure.
Solutions Community Counseling and Recovery Center. Please check out the rest of the State of Mind speaker series. We have lots of topics on oneinfive.org and in partnership with MindPeace. So thank you all so much for joining us.
Thank you. Be well.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1in5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.